Welcome back. Thanks for staying with us. The Coalition for Women's Health in Africa is a collective membership-based private health sector action platform which strives to develop an enabling environment for the advancement of women's health in Africa. The coalition has launched a women's health initiative to advocate and implement solutions to improve healthcare for women on the continent. For more on this, we're joined by Mokgadi Mashishi, the Business Unit Director at Organon Sub-Saharan Africa. Very good afternoon to you, Mokgadi. Thank you for your time. Talk to us about this project. I mean, it sounds like a fantastic initiative, especially looking at the many challenges when it comes to women and health.
No, absolutely. Thank you so much for having us on your show. So the Coalition for Women's Health is actually a result of a congress that we had in February in Nairobi, which was focused on African women's health, and Organon was one of the key sponsors at that particular meeting. And we held a side event where we really focused on how can we unite for women's health on the African continent to ensure that we can augment and the impact that we have, and also ensure that we minimize the level of duplication of efforts, and rather find a way in which we can start to encourage more collaboration and increased level of partnership to ensure that the impact on women's health can be a lot more visible and a lot more scaled up.
What are the challenges?
I'm happy that...
Yeah. Pardon me. What are the challenges when it comes to gender equity in accessing health?
Well, in most instances, women are really disempowered. And when it comes to them accessing healthcare, they have challenges either due to unemployment or not even having any resources to ensure that they can access healthcare. And then in some countries, they are not even able to speak up on their needs as well. So those are some of the things that we are trying to solve for. And we're wanting to ensure that through partnerships and collaboration, we can bring healthcare to women where they are at. And some of the initiatives would include training healthcare workers who can reach women in those difficult to reach areas of the different countries on the continent.
Is there a specific drive when it comes to some aspects of health that you're really looking to hone in on and focus your efforts and research in?
Absolutely. So for a start, for the coalition, we're going to be prioritizing two areas in particular. So the first one being the cancers that impact your sexual and reproductive health, things like breast cancer, cervical cancer. And then we'll also be focusing on reproductive and maternal, neonatal and child health as well, because we also know that in Africa, the African woman is many more times likely to die giving birth than someone who is, for example, in Europe. So those are the areas that we are hoping to partner with governments to ensure that we can support in creation of infrastructure, but also in capacity building and also provision of resources to ensure that more women can be saved while they are giving birth.
And that's something massive in terms of scale and the impact that it has on society in general. But as you talk about the cancers, I mean, that in itself is a massive conversation and a huge area of concern, especially as the pace, it all happens so quickly. And if there are delays, it can be fatal.
Absolutely. And that is why, a lot of the initiatives will focus on screening, creating awareness, and also ensuring that the language that is used when we speak to women actually reaches them, because it doesn't help that we have initiatives where we are talking at women rather than actually bringing them in and making them part of the conversation, and ensure that how we communicate, how the counseling is provided can help us to dispel some of the myths that exist, in the different cultures with regards to certain diseases. So the more we open up opportunities for women to speak, the more it becomes a lot more accessible, because again, access is not just about being able to work from home and get to a healthcare facility, but it's also to get healthcare that is good quality with the language that you can actually understand at the level that you can understand and in a dignified manner as well.
You speak about the myths, a very interesting angle to look at here, because the perceptions are many. Talk to us about some of those myths that you've encountered and that you've had to really encourage people to break away from.
Yes, so I will touch a bit on the cancers, but then also bring the conversation to family planning. So if we look at cancers, you could find that, in some instances, when someone starts to have a sore, there might be beliefs that this person is bewitched, or it might be called by a different name. And that just, by trying to get support from the different parts of the healthcare system that might not even be within the formal health structure, that might delay detection. And that is why it's important to actually bring in other stakeholders, including traditional healers, including traditional leaders, including other organizations that might be great at infrastructure. I mean, if you think about Coca-Cola, for example, they're able to get their product to any corner of the world, right? So we need to start thinking about non-traditional partnerships like those as well. And then now bringing it to family planning, and particularly looking at teenagers. We know that teenage pregnancy is extremely high across all African continents, and COVID-19 didn't help the situation as well. And there's a lot of myths that have to be dispelled in that space where, there are some countries that believe this is a Western issue that we shouldn't be bringing to the table. And there's a lot of taboo around speaking openly about sexual and reproductive health. But unless we start that conversation, we will continue to have challenges with teenagers falling pregnant, because maybe when they're sitting with their friends, they're told if you have sex standing up, you are unlikely to fall pregnant, or drink whatever after, the deed, and you will actually not fall pregnant. So by opening up about this conversation and ensuring that there is young people who can speak the language they understand. In some countries, there is art forms that are used to educate young people. In other countries, they are using apps to ensure that they are able to actually access the information at their language. In some countries, they've developed youth centers that are youth friendly. You're not going to find someone who'll be like, what are you doing here trying to find, to get a contraceptive? So it's by starting to create those changes that we are then building up on young people, and then ensuring that they are able to make choices. We are allowing them the right to access, to exercise their power of choice in terms of, when to have babies, whether to have babies at all, and women in general as well. And by so doing, this also unlocks the potential to actually reach their full potential in terms of their dreams, the possibilities that exist. And, that just ensures that we're building on a better society for tomorrow. And you spoke about gender equity, and that is critical, because unless we create the level playing fields in terms of ensuring that the women are also, on the same playing fields as men when it comes to economic empowerment, that also helps them then to be fully fledged citizens of the country, and also ensuring that there's policies that support women on their journey for motherhood or whatever the case may be. And we can enable them to do that by ensuring that there is sufficient information available, access to the relevant products for contraception as well.
Very well. And before we let you go, perhaps speak to some of the challenges that you're seeing across the continent, and also looking at South Africa specifically. I mean, you speak about the use of technology and how advanced it is elsewhere.
So I think some of the challenges that we face is around infrastructure. So there is a need again to have those partnerships, and in some instances we might need to call on telecoms companies to potentially consider how can they support healthcare in terms of provision of data for people to access information, right? And then we talk about challenges around just simply being able to get to a healthcare facility where you will find that product is available. And I know there is strides, from the different departments to actually try and improve these systems. But we need to accelerate on that, and we can accelerate the pace of change by partnering, by collaborating, to ensure that we can tap into each other's expertise, into each other's thought leadership in the various aspects to bring about the required improvements.
Very well. Thank you so much for your time. Let's leave it there for now. Mokgadi Mashishi, the Business Unit Director at Organon, Saharan Africa, giving us some insight on the scope in health.